If you have failed the NCLEX exam multiple times, right, and you are tired of failing the NCLEX exam, I want to show you how the examiner wants you to think related to any question, right? Every question, let me say every question on the NCLEX exam, so that you have the ability to pass the NCLEX exam this time around. Now, let me walk you through. Now, everything you are doing, whether you are studying for 30 days, 60 days, or 90 days plus, right? The whole goal is to be able to go on the NCLEX exam, see your question, and have the ability to answer that question. That is the whole goal. So everything we are doing is for us to go on the exam, see our question, and be able to answer it correctly. Now, a lot of students will spend 30 days, think they 30 days is not enough, spend 60 days, think 60 days is not enough, spend 90 days or more, and they will still end up failing the exam. Why? Because it's not about how much time you are studying or how long you are studying for. It's about what you are studying that give you the ability, right, to pass the exam. So if you are going to fight a war and it's you against 1,000 people, guess what? No matter how long you train, whether you train for 30 days, 60 days, 90 days, or more, you will not still win that war, because 1,000 people against you, come on, you are going to be beaten up, right? So that is how the NCLEX work. The war we are trying to fight right now is the ability to go on the NCLEX exam, see a particular question and get it correctly. So whether you are studying for 30 days and each day you are studying for 12 hours, 3 hours, 5 hours, that will not still make you pass the exam if you are studying wrongly. Now, it's not a secret, but most students that are overwhelmed, that don't know what to do, it's a secret to them. Now, if you are trying to answer NCLEX question, every NCLEX question is broken into 3 parts. Every NCLEX question, we have the body of that question, we have the stem of that question, and then we have the answer keys. Now, let's identify that. Now, this is the body of the question, this is the stem, and we have our answers. So let's just call these answers. Right. So we have the body of the question, we have the stem of the question, we have the answers. Now, the body of the question is the nursing information. So right here we have, this is the nursing information. Right. Now, the stem is the examiner question. Right. Your answer key is a group of wrong and correct answer. Right. Wrong and correct answer. So now, this is how the examiner thinks. Now, when the examiner wants to write your question, this is what they do. They have a list of content and they have how they want to test the content, and they have how they are going to present the answer. Now, this content right here, sometimes NCLEX is going to like put the content here directly, that you are just going to see the content. Or sometimes the NCLEX is going to give you information like this that will describe that content. So you need to understand that information and be able to like understand that information and then be able to say, oh, okay, this information is related to this particular content. Right? Sometimes it's just like, now, let us say let us say the NCLEX is saying a patient who has an advanced directive. Now, this is a content on the NCLEX exam, right? This is straightforward, because if you check the NCLEX content, you will find out that this is very straightforward, because advanced directive is what the NCLEX have. And when you answer your question, they also gave it to you as advanced directive. So you don't need to overthink this. We know that the examiner is testing advanced directive. Now, another way NCLEX can test advanced directive without not telling you, writing the word advanced directive, is by telling you that a patient is worried about the kind of care they are going to receive when they are unable to communicate their needs. Now, what is advanced directive in the first place? Advanced directive is a document that states what the client wants and what they don't want when they are incompetent. Now, you see, instead of the NCLEX now telling you advanced directive, right? in your question, the NCLEX describe a scenario or an information related to advanced directive. So NCLEX replace this word with with a scenario related to advanced directive. So if you are somebody that you've gone through the NCLEX content and you know about advanced directive, even when the NCLEX did not write the advanced directive in plain, you understand that when the NCLEX say a nurse is discussing or communicating or talking with a client, most especially these are when NCLEX used to write it. NCLEX will say a nurse is talking with a client who stated that they are worried about the kind of care they will be receiving when they are unable to communicate their need. Instantly, because you understand the NCLEX content and you've gone through the NCLEX content, you already know that, oh, this information is screaming advanced directive. So now the next thing now is to now pay attention to what the examiner is testing related to advanced directive, which is the STEM. So the STEM now is the question, because from the body of the question, we'll be able to understand that this question is all about advanced directive. Now the STEM will now ask us something, because advanced directive is a content that has a lot of information in it. Every NCLEX content have a lot of information that NCLEX wants you to know, but the NCLEX can decide to test you on a specific information or in general. There's two ways. Is that the NCLEX is trying to say, okay, let's only test this student about this, or let's test the student about everything related to advanced directive. The examiner is going to decide that. That is the reason why after you understand the content the examiner is testing, you still need to pay attention to what the examiner is asking related to that particular content, so that you don't overthink. You only focus on what the examiner is asking you. And I can 100% guarantee you, once you can know the content or the care that the NCLEX is testing after providing you a certain information in the body of the question, you are able to understand what the examiner is asking related to that content. I can 100% guarantee you, you will start thinking about the answer. I can 100% guarantee you. I have been doing this for the past 3 years. I've helped over 1,000 students pass the NCLEX exam. 80% of this number were students who have either failed once or multiple times. And every time those kind of students come to join my coaching program, they end up passing on their next attempt, just because I explained this simple thing right here to them. And it's not about doing it related to one question, it's about two things. It's about understanding the NCLEX content. Most students know that they need to study some certain content for the NCLEX exam, but they don't know the NCLEX content. They study random content that question bank provides to them, or some certain coaching program provides to them, instead of studying what the NCLEX wants. Now, the NCLEX have a document that have stated all the content that you need to know. Many students don't know this, and that's the reason why they keep asking the question, what content should I know for the exam? Whereas NCLEX has stated every content that you need to know for the exam. NCLEX has been doing this since 1944. This is 2025, and most students are still worried about what content will be tested on the exam. NCLEX has been providing the content that will be tested on the exam since 1944. So that should not be a problem in 2025. It means that your problem is big, very big, and one of the reasons why you are failing the exam. Because if in 2025 you are still worried about what content will be tested on the exam, then it means that you don't even know anything about the NCLEX. You have been gambling it all this while. Also, the second thing you need is question. Now, many students, when they think about question, they think about question bank. You don't need question bank first. Question bank can come later, but you need to pay attention to the NCLEX past question. NCLEX as well to provide past question as well too. I mean, question that have been previously tested before. Like this question that you are seeing on the screen right here. Let me clean everything I have on the screen real quick. Right, so that we can have a fresh sheet. Now, this question you are seeing on the screen right here, this is not my question. This is NCLEX question. This is NCLEX past question. This is a particular question a particular student have answered before on the exam that the NCLEX gave out for practice. So this is not my question. Remember what I'm saying right now. This is NCLEX past question. This is not question from question bank or any program that you are using currently. This is question from the NCLEX examiner themselves. NCLEX past question. I just screenshotted it and I pasted it here for us to practice. It's NCLEX past question. Now, the reason why you want to know NCLEX content is you now know what to study. you are not guessing what to study. You know exactly what to study. And the reason why you want to know the NCLEX, you want to study NCLEX past question, is for you to start seeing how the NCLEX tests on what you need to study. Right? You can have your lecturer and the NCLEX examiner trying to test you related to hypertension. But guess what? The way the NCLEX examiner will write the question related to hypertension will be different from the way your lecturer will write question related to hypertension. That way, if you go on the exam and you are paying attention to what your lecturer is saying, you can go on the NCLEX exam and be confused because both of them are not using the same writing style. That is the problem when you pay attention to the wrong person. Who should you be paying attention to? You need to be paying attention to who write the exam. That's the reason I'm telling you the first thing you need to pay attention is the NCLEX past question, not question bank now. The moment you've built all necessary understanding related to how NCLEX write the question, now you will start understanding related to question bank, what the question bank are doing wrong and what you know is right. So question bank will not be able to dominate your thinking and lead you to confusion. Instead, you already know what you are doing. Nobody have the ability to confuse you again. Right. So question bank first. Past question first, question bank later. Now let's go back to answering this question related to the body. You see, as when we understand the body, we understand the stem, we are going to start knowing what the answer will look like. But I'm going to walk you through the process. I'm not doing it, we are doing it together. So pay attention to me. Now, when NCLEX is writing question, most times you will see NCLEX they will write question like this, they put full stop, they will continue, they will put full stop, they will continue, they will put full stop. The reason why NCLEX is breaking every sentence, right, is because, or every statement, is because NCLEX wants you to pay attention to one thing. NCLEX wants you to pay attention to this particular statement, right? This is the first issue, but this is the next thing that have been done related to this issue. This is the next thing that have been done related to this issue. So this is the current thing that we are being tested on. Right. Now, listen to me. Let's pay attention to the question. Now, when NCLEX want to write question, sometimes NCLEX will give you the patient problem and give you their sign and symptom or what they are experiencing. Sometimes they will give you the problem, they will give you the sign and symptom, what they are experiencing, and they will give you the intervention. Now, it's just like now, if you have a patient who walk to the unit, they come with their sign and symptom, we have not done anything for this patient. But the moment we do an intervention, it means that we've done something related to this patient problem. The next thing we are thinking of is to evaluate if this patient is fine or not. So if you are trying to answer a particular NCLEX question and you note the problem, the sign and symptom, and there's an intervention, it means that the intervention has been done related to the patient problem or sign and symptom. The next aspect of care is evaluation. Now, when you are trying to answer NCLEX question and you see intervention, the patient problem and intervention, most likely you might not see the sign and symptom, but you see problem and intervention. It means that the problem right now in that question is, or what we are trying to do, or the key in that question is, we are trying to evaluate if this intervention is causing problem. Let me just say we are trying to evaluate. Let me not even just go any further. Let's just say we are trying to evaluate the patient's situation now. So now, also, NCLEX sometimes can describe the nurse. NCLEX sometimes will not describe the nurse. Nobody cares if the nurse is pregnant. The only thing that we care is for the nurse to care. But guess what? Sometimes NCLEX will say a nurse, like many of the time NCLEX is going to say a nurse. But why is the NCLEX saying a nurse who is pregnant? It means there's something about this nurse that is pregnant that the NCLEX want us to pay attention to. Right. So I'm just giving you hints, but let me do something real quick. Let me try to put the question back again, right? So let's go through the question together. Now, we have a nurse who is pregnant who is assigned to care for a 3-month-old client. Now, NCLEX, 90% of the time, NCLEX is going to say a nurse. NCLEX is not going to describe the nurse beyond saying a nurse. But the fact that the NCLEX say the nurse who is pregnant, what it means is this, right? It means that there's something about this nurse being pregnant that NCLEX wants you to pay attention to. So we are taking note of this. Now, assigned to a 3-month-old client with RSV, right? So that's the patient's condition, right? And guess what? They said this patient is already receiving a particular therapy. So that is the intervention. So in the face of care, this client, we are not trying to fix the problem again. The problem is already being fixed because this patient is already having a particular therapy that is fixing this problem. So now, what is the main issue right here is no more this again. Instead, it's this and the pregnant nurse. It has something to do with a pregnant nurse being with a client who is currently receiving this therapy. Now, in the dictionary of safety of the NCLEX exam, when a nurse is pregnant, there are some certain care that the nurse need to take note of, some certain care that she's allowed to do, and there's some certain care that she's not allowed to do because of the state that she's in, which is pregnancy. So now, if you understand this thing about the NCLEX exam, right, guess what? You are going to start saying, oh, there's something about this pregnancy that will be related to this. Even when you don't know, you already know that if NCLEX describe the nurse is pregnant and there's a particular maybe therapy, maybe that therapy is dangerous to the nurse being pregnant. So the next thing, now you see, the moment we understand the body of the question, right, we already know the kind of answers to expect. Now, I will predict the answers for you now. One, is it that the nurse will say no, she don't want to take care of this client, or she's going to like change assignment? That's the two things she's going to do. Is that she will say no, she's not going to take care of this client, she's going to change her assignment, because the safety rules state that when a nurse is pregnant and there are some certain therapy that can cause problem to her pregnancy, she should not do that particular task or change her assignment. That is the safety rule. So if when I understand this question so well, I already know the answers to expect, even when I've not read the STEM and I've not gone through the answers. That is the power of understanding the body of your question. And most students cannot understand this until they have a coach that is going to make them understand it. A coach, somebody that understands the NCLEX well, so well. I definitely understand the NCLEX so well. I can 100% guarantee you that. I've been doing this for the past 3 years. I've helped 1,000 students pass the NCLEX exam, most especially helping students who have failed more than multiple times, right? 80% of those number of students who have failed multiple times, and I've helped them to pass the NCLEX exam successfully. Now, I can definitely do this for you if you are struggling. Now, the examiner is now saying which of the following action would be most appropriate for the nurse to take. So guess what? You see, the examiner is just asking us a particular question related to the understanding that we have created here. Now, one, we understand that this client is no more needing treatment. Instead, they are already getting treatment. So we don't need to give this client treatment again. So now it's not about the treatment this client is receiving and whether it's a problem to a nurse who is pregnant. And guess what? This is screaming that it is going to be a problem, because that is the NCLEX safety rule in the NCLEX safety dictionary. Right. So now we already know the kind of answers to expect. Now, guess what? Let's look at the answer. You can see this is saying we should maintain transmission-based precaution while caring for the client. Now, no matter the kind of precaution the nurse wants to use, if the therapy is going to be a problem to the pregnant lady, we don't want to take the risk pregnant, the nurse who is pregnant, the baby is at risk, someone's life is at risk. So we don't want to even take the risk. So this is not the right answer when we are thinking about safety, right? Because someone's life is at risk, we are not taking that risk. We want to say no to that kind of treatment as a pregnant nurse, or change our assignment. That's the two answers we are looking for. So this is a no. Right. That answer look interesting, but because of the risk, no, we are not taking that risk. Imagine we do this and then something happened to the baby at the end of the day. You have yourself to blame. You say, okay, you could have said no to that treatment, or say, or change your assignment. Now, request a change of assignment, which is a positive answer. Discuss the assignment with the physician, which is also something that you want to discuss, but who are you discussing with? It's the charge nurse that have the ability to assign, not the physician. Physician don't assign for nurses. It's the charge nurse. So this is correct, but saying the physician is what makes this answer wrong. Switch the client assignment with coworker. No, the charge nurse need to do the switching, not you switching with a coworker. So that is why that is also wrong. Now let me try to have a clean sheet again. Paste the question back again. Right. Now this is the question back again. Now remember the body of the question is like, we have a pregnant nurse with this therapy, which according to the NCLEX safety dictionary is telling us that there's a problem related with this therapy to the pregnant nurse, which the nurse need to say no to that assignment or changing of that assignment. Now, guess what? How do we know that our thinking is right? If you notice, right, the question have assigned here, and if you notice, this is talking about assign, assign, assign. I always used to tell students this: if you have a particular question, that when you read the body of your question and you come to your answer key, and then a particular word that was used in the body of your question appear more than 2 times, 2+ in your question, it means that that's what the NCLEX is testing you. So when you are carried away by this, carried away by this, carried away by this, NCLEX is testing assign. Because if you notice, assign appeared 3 times. So it means that this is what the NCLEX is thinking of. So it's a shortcut to know what the NCLEX is really testing. So that way we know our answer cannot be this. Our answer will either be this or this. Any of these three. So now, what is the problem related to assign? But knowing that the question is testing assign is not enough. You also want to know what is the problem related to assign. Now, this is saying we should change the assignment. So why are we changing the assignment? Now, according to the safety dictionary of the NCLEX, we are changing the assignment because it's not safe for a pregnant nurse. So this, we have a reason why we should request the change. Now, this is also saying discuss the assignment with the client physician. But guess what? Who did the assignment in the first place? It's the charge nurse. So why should you not discuss with who did not do the assignment, which is the client physician? So client physician is wrong. He said the nurse should discuss the assignment with the charge nurse, not the physician. Because the NCLEX is physician, that's why this is wrong. Switching assignment is wrong. You don't want to switch the assignment. You want to make sure that your assignment is known to the charge nurse. So the charge nurse will not do the switching herself, not you doing the switching. So that's why this is wrong. So now you can see how to understand the NCLEX exam is not difficult, and how understanding the body of the question, the STEM, lead you to the answer even when you've not gone through the answer. Now, I want to give you this ability to understand NCLEX question without not struggling. You can do this with me for the next 60 days. Right? I know you enjoyed what I just showed you, but you can enjoy more, right? Which you don't just only get to enjoy it, you get to walk through this process that guarantee you to pass the exam, even if you are struggling before, right? Because I'm going to walk you through how to understand every single NCLEX question, and you are passing the NCLEX exam in 85 questions. So if this is what you want, you are tired of struggling, you want to pass the NCLEX exam, let's give you this ability to pass. Let's take you from someone who is confused, that don't know what to do, to somebody that is going to walk out of the exam knowing that they are a licensed nurse, right? And it's very simple. All you just need to just do is to spend $8 each day for the next, right, 60 days, right? For the next 60 days, right? $8 each day for the next 60 days. Just 1 hour of coaching for the next 60 days. Many people will charge $120 per hour, right? Some will charge $75 per hour. If you are doing this, you'll be spending around $4,500 in the next 60 days. If you are doing this, you'll be spending around $7,200 in the next 60 days. But what I'm just charging you is $8 in the next 60 days, most especially $8.28, which give you $497, right? So $497 that guarantee you to be a licensed nurse, right? I believe you will take this offer. And I'm not just even giving you this, I'm giving you the opportunity to jump on this now if you are unable to pay this full amount by using payment plan, where you can drop a down payment of $250 and tell me when you are going to make the next payment within 30 days. That is it. You just need to pay this now and tell me when you are making the next payment within 30 days. And that is it. You get to start this program today and end up passing the NCLEX exam when you take it in the next 60 days. Guaranteed. Right. If you, most people will say, okay, what is the guarantee that you are going to pass, right? The thing is this: I know what I have in my coaching program, and I know it's 100% guaranteed to help you pass. So the guarantee right now is, if you can go through day 1 to day 60, you have the ability to pass. So my program is not to guarantee you of failing and what should we do next, because we don't have failing here. We don't have failing here. The guarantee is, if you can go through the 60-day coaching program, you have the ability to pass. I'm not that kind of person that will tell you, if you fail, this is what we are going to do. No, the guarantee is for you to pass. So the guarantee is not to give you what will happen if you fail, because we don't have chance for failing here. You have the ability to pass. I have everything you need in order to pass the NCLEX exam, and what we can do, everything, you're 100% going to pass the NCLEX exam. So right now you're asking, how can you get rich to me? So this is my number: +1-767-613-0769. So +1-767-613-0769. You can contact me on WhatsApp, iMessage, do anything to reach out to me. Just let me know you are interested in joining my coaching program, and I'm going to enroll you into my coaching program. And once you join, trust me, the end result, your transformation, is you becoming a licensed nurse after struggling for a lot of times, right? So contact me right now: +1-767-613-0769, WhatsApp or iMessage. I will respond to you and I will enroll you in my coaching program, and we can start the process. So with that being said, I'm going to see you in the next one.